name is Maria. I did basic research for several years, focusing on the mechanisms of drugs of abuse. I'm currently doing clinical practice, working with kids.
We must work untiringly so that our children are obliged to learn the truth. Because it is only through knowledge that we can safely protect them.
Curious About Cannabis is dedicated to providing reliable cannabis science education to anyone curious enough to learn. To get access to free courses and other educational resources, visit learn.cacpodcast.com and become a Curious About Cannabis member for free. The Curious About Cannabis book provides an incredible crash course in cannabis science through over 500 pages of content filled with photos, activities, science experiments, games, and more to help guide you through your personalized cannabis education journey. This book has become a trusted textbook in colleges and universities across North America and is absolutely perfect for serious learners, as well as cannabis educators, bud tenders, clinicians, patients, and caregivers. And special thanks to the many individuals, companies, and organizations that have helped Curious About Cannabis meet our mission of becoming the #1 trusted source of cannabis science education on the planet. This includes organizations like Credo Science with Ethan Russo, The Kenigma, Treadwell Farms, The Spellman Report with Kevin Spellman, The Workshop, Green Earth Medicinals, CBD National, Magnolia Botanicals, and more. Visit cacpodcast.com/sponsors to learn about our sponsors and go show them some love for helping us spread cannabis science education far and wide to anyone curious enough to learn. If you like Curious About Cannabis, consider checking out some of these other learning initiatives by Natural Learning Enterprises.
Life, mysterious and ephemeral, breathtaking, yet fierce and unyielding, grounding, yet transcendent. It's a curious thing. Let's explore it together. Isn't life curious? Available at isn'tlifecurious.com or wherever you experience podcasts.
And now, back to the show. Hey everybody, this is Jason with Curious About Cannabis. Thanks so much for tuning in once again. So today we are talking about a very interesting study that I came across, particularly because from my interview with Dr. A.D. Ray that you may have heard several episodes back. But we're here to talk about a very interesting study that focuses on how high-CBD cannabis vapor influences opioid-seeking behaviors. Super fascinating. So I'm here with Dr. Maria Rivera-Garcia, who is the lead author on this study. The name of the study is called High-CBD Cannabis Vapor Attenuates Opioid Reward and Partially Modulates Nociception in Female Rats. There's a lot to dive in here. So Maria, thank you so much for carving out the time to join me today and talk all about this study. I think there are so many interesting nuances to this study. I'm really excited to break it down and expose this to our audience. I think they're going to love it.
Yeah, thank you so much for having me. I'm really excited, just to be here with your audience. I've been listening your podcast. So yeah, I know that you have like a wide variety of topics. So yeah, it's exciting just to, go over the paper. And yeah, I don't know, it's kind of recent, the paper. So yeah, it's a good exercise for me as well, just to, go over again. And I mean, I was the main author, but it's just still like every time I read it, it's just like, oh, this is nice to read again. And there is new questions coming out and stuff.
Exactly. Yeah. When you go through the kind of tornado of research and publishing, I think people sometimes underestimate just how chaotic that process can be. And when you get to the other side and then you even after the paper comes out, sometimes you're like, okay, I know that it came out, but I'm still working on other stuff. And then you go back and you read it, and sometimes it even feels like, who did this work? Was that me?
Yeah, totally. Yeah, that's totally true. Like, oh, did I do this? Really? Yeah.
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 Well, and to highlight a couple of points of why I think this study is special, and then we'll just start to kind of get into what the study actually was. But a couple of main points. This was a preclinical study with rodents, but particularly it was with female rats. Right. And so, do you mind explaining a little bit, why did the study focus on female rats? Because this really touches on a kind of a major philosophical issue in biomedical research that goes way beyond cannabis.
Yeah. So I guess I'm gonna give you a little bit of like why I started doing research with females.
Yeah.
And so I'm from Mexico City. I did all my pretty much my academic studies there. I did a PhD in neuropharmacology, and I started being interested just to study the mechanisms of drugs of abuse. Then I moved here. I was working for 3 years in the Mogdam lab. Like I was very, very interested in studying sexual differences in the mechanisms related to reward, like release of dopamine, like different motivated behaviors. So I started there sorry. I started doing research, just like studying sex differences. And then for different reasons, I felt like my time in Mogdam Lab finished. And then I found AD. And because of my background doing like vapor inhalation studies, and because she was also interested, having a postdoc because she was starting her lab. So we found each other in the perfect time. And I told her, like, I'm really, really interested doing like sexual differences. Continued like doing this research. And she was like, oh, that's what I do. So we started doing that. And this is a very, from my point of view, I needed to do this switch in science, in the sense like, or this change, I will say this change in science, because, like all the years I was doing research, it was just males. And just like wasting the females. And it's super sad, like I know there is a lot of ethical issues and a lot of groups now that they don't like researchers, but especially when we are just wasting animals just because they are females, it just like doesn't make any sense. And
why is that? Can you explain to folks that are kind of unfamiliar with how animal research happens and all of that? Like, why is that the case?
Well, historically, it has been, like, because the main justification, it was because there is a lot of variability because sexual hormones. So either the way for several years, the way that like researchers approach that was just to take the gonads, like just remove the source of variability, and then they could use females. But that implied, like technical abilities, more time in your research, and they were not, like willing just to do it. So it was, let's just focus on males. But now, like in recent years, probably like 10 years ago, they started going more to this other approach. Like, we are trying to do translational research. And I mean, I understand like the main focus of basic research is just to generate knowledge. But, like this trending to do translational research is really, really important, because we cannot continue doing just basic research and don't talk to the outside world. So, there is some like studies now showing that there is also a lot of variability in males, because they have dominance, because they have different, like levels of testosterone. It's just like based also on the simple characteristics like the weight. There is dominance because like the bigger male is just like, so there is now like this idea in science just to include, like a representative sample of what's happening also in humans. And yeah, there is a lot of variability also in between animals. It's just like we cannot just like focus on males, or like overactimize the females and then just study them. So
Well, it's kind of a series of kind of mistaken assumptions leading to a lot of misrepresentation in a lot of the data that does come out. Because that's immediately what I was thinking is like, well, one, there is variation in males. It's just not always, I think sometimes we just assume there's not, because it's not as, I guess, a dramatic presentation, so to speak. You don't see it so much on the outside in terms of like menstruation and stuff like that. But there are all of those variables. And then I think a lot of people don't understand that in so much preclinical research that's been done up until recent decades, that there really has not been that representation of even on the rodent organism level of females. I think there's just a lot of people in the world that really don't know that that's the case,
right.
And that just has a lot of implications on how we interpret the data that's come before. So that was the first thing. I think it was even like one of the first sentences or something I read in the paper. I caught that and I was like, ooh, this is going to be good. Like this is actually taking into account these variables that are real. Like this is real life. These variables exist. So that's huge. And I didn't mean to interrupt you, but I just want to make sure we give the context there because some folks may not appreciate just how big that is.
Right. Yeah. And even in clinical studies, like there is also like a trend just to include more males than females because of the same reasons, like there is a lot of variability because the menstrual cycle, but it's just like, well, like we know now, and that's one of the points of the paper, is just like there is sex differences in, like developing of addiction, like the onset or just to establish the addiction is just like faster in women than men. The withdrawal symptoms are worse in females. It's just like there is a lot of reasons just to study females in basic research, but we haven't.
And the experience of pain too.
Yeah.
The experience of pain seems to be different as well. Yeah.
Yeah, that's the other thing. There is like higher rates of like women living with chronic pain.
Yes. Yeah. So let's get into the different variables and things that you monitored, because there's actually quite a bit. One thing I appreciate about the study is how robust it is in terms of really taking care to measure a lot of things, monitor. Like you monitored when the cycles of these female rodents was changing, so that you would understand, what's going on with their physiology when you're taking different measurements and that sort of thing. Right. So kind of unpack a little bit, what went through your mind when you're thinking, like, what do we need to measure in order to make sure that this data set is, really solid?
Yeah, I know it's a very big paper, and actually it started growing and growing and growing while we were performing.
That's how it goes, yeah.
So we were performing the experiments. I was like, oh, we have to do this and this and this and this. And it was just like, actually we have more data that we didn't publish in this paper. But anyways, so basically AD had the idea of testing, like the co-administration of this whole plant extract with high CBD and very low percentage of CBD with morphine, pretty much, in the context of pain, like how that will be helpful, in nociceptive stimulus. But then I came to her lab, and my experience in behavioral pharmacology, it started doing more like the cognitive, analysis and the anxiety aspect. And then she also had in mind way before just to test the safety, just the how just the acute and chronic vapor inhalation of the whole plant cannabis extract will impact just like very basic variables of like like health variables, like if it has like some impact in the lungs, if in female, because we were using females, if the vapor alters the estrous cycle, and then I came and it was like, why we don't do like a behavioral analysis, especially because CBD has been proposed to be like useful for cognitive impairment. It apparently people say that it reduces anxiety. It hasn't proved yet, like experimentally. And yeah, we started doing like all these, variables, and it ended up being a really really big paper. So yeah, I started with the safety profile. It was really really important just to see if having this chronic inhalation, it was like for 20 days, like 2 times per day. And that time, I mean, we can say like it's just 20 days, right? But that time frame for a rat is just like really really big in a rat life.
Yes.
So
Yeah.
uh so it was, so what we found, it was actually, well, something also important that you probably saw in the paper is just like we compared the whole plant extract vapor to the excipient, that majority of vapor inhalation papers or science use, which is a mix of vegetable glycerin and propylene glycol. So people has been using this compound just as a vehicle to deliver vapor,
Right.
different kind of vapors, and allegedly it was just innocuous. It doesn't have any effect. But in recent years, it has started becoming more like this. They started showing more evidence about how it can also have a negative impact in the lungs,
Yeah.
in those like electronic cigarettes devices.
Yep.
So it was really really important for us just to compare what happened with the cannabis extract versus this vehicle. Interestingly, we didn't find like differences, like, and we didn't have actual like an actual reason to think that it was going to be different.
Sure. Yeah.
But when we compare, like the both the whole plant cannabis extract and the PGVG, because it's just like it stands for like propylene glycol and vegetable glycerin,
Right.
with animals that we just put in the chambers without vapor exposure, then we saw a difference. So meaning that just the vapor inhalation itself has a negative impact in the lung cytoarchitecture.
Interesting. Yeah. Regardless of whether it had the cannabis extract or it was PGVG,
Right.
just inhaling that vapor, you were seeing some differences. I remember seeing in the paper you noticed some like airway abnormalities,
Right.
And things like that formed. And I want to make sure to highlight what you mentioned for everyone listening, that the extract that you used for this was a whole plant extract. So this wasn't like a CBD isolate or distillate or something. This was a full extract. I remember it even said where you got it from, the Applegate, which is near where I lived in
Yeah.
Oregon back in the day.
Yeah, that was also,
And I think,
I'm sorry, that was also very important for AD, and like,
yes,
because together with the fact that there is no females, in cannabis studies, it was also historically all the cannabinoid research in basic science has been mainly focused in routes of administration that doesn't represent what happened in humans. It's just
yes,
like
yeah.
we know that majority of users of cannabis is just like right now like smoking or vaping. Some
Yeah.
some of them have like preferences for edibles or tinctures, but like people doesn't inject cannabinoids, and that was the main route of administration that researcher or that people use in basic research. So for different research,
Yes, that's a huge limitation to point out because I think some people really like to quote a lot of preclinical research that's been done to date to justify a lot of marketing claims and things like that. And it is really important to point out that a lot of those studies not only used isolated compounds, but also they're injecting these things either directly into muscle tissue or directly into the blood or under the skin, depending on what they're measuring. And none of those administration methods relate to anything that people are doing in the real world.
yeah, yeah. Actually, there is a lot of like differences in the concentration that it reaches when people smoke it versus like when you administer something underneath your skin or in the belly or something. It's just like the pharmacokinetics is completely different. The time, like the time to reach the concentration in blood or like the peak concentration in
The
blood, like
max, yeah.
or the absorption itself, the metabolism, just like everything is different. So the whole experience is just like it's not the same.
Yeah, and it's like the theme of this research is like trying to, and like you said in the beginning, translational research, making the research, practically representative of reality, trying to, including females, using whole plant extracts, administering it through a vapor. I think some people might gloss over these details if they just see this article pop up on Google Scholar or something and they're like, oh, that's cool. But like, this is not done. Like the vast majority of research studies, and I can tell people listening, I've read so many of them, I can assure you that this is not common at all to see a study that is utilizing all of these components carefully to really try to represent what people are experiencing in the real world. And while, yes, there's always going to be limitations with rodents versus humans, I really appreciate the thoughtfulness that went into making this as translational as possible. And anyone that doesn't know that term translational just means, can we take the data that comes out of this rodent study and apply it to humans? And how well can we, translate
Right.
those findings?
Yeah, again, we are just trying to understand what happened in humans, like doing preclinical research. So yeah, we were far away to understand what was happening with females, and especially using this route of administration, which is just vaporizing the compounds. And yeah, the other thing to mention, really important, is just the whole plant extract and not just like the pure, chemical compound from, like completely very synthetic pharmaceutical provider. So,
Exactly. Yeah. So whatever effects that you notice, that it's coming about in the context of this, really polypharmacy, all of these different compounds that are in that botanical that are working together, which is much more realistic. And let's set up, kind of what the whole point of the study was. So you wanted to see how exposure to this vapor influenced both the effects of opioids as well as the opioid-seeking behavior, and in the context of neuropathic pain.
right.
So talk us through a little bit about, once you got all of these variables defined and you figured out what you wanted to measure, you already said that these measurements went through a very long part of the rodent's, life history, basically. So you get a lot to work with. How did you measure the pain aspect? How did the opioid-seeking stuff kind of fit in? And then we'll get into what you noticed, what you saw.
Yeah. So the measure of like pain, we use like 3 different approaches, basically using three different kind of stimulation, which is mechanical, thermal, and chemical stimulation. So the mechanical is just like touching the paw of the rat with a small filament and see if they notice that it's not painful. But if they have like this kind of pain, or we call it allodynia, which is an exaggerated response to a stimulus that it doesn't induce pain itself, in normal conditions. But if you have the condition in which you are experiencing an exaggerating response to this stimulus, then you perceive it as a painful stimulus. And then we use the chemical stimulation, which is basically like a chemical, it's acetone, and it induces like this kind of painful reaction also in the paw of the rats. And the thermal
probably a burning,
like burning something. And the thermal stimulation is just like a light, like if you apply like with a lamp. It's actually a kind of lamp that we the source of the stimulus is a lamp underneath the paw of the rats. And again, it's just like we make sure that they don't experience pain, that we don't damage the tissue or anything. Right. We cut off like way before that it induces an actual damage in the paw. So yeah, those were the approaches we used to measure just the pain. And we first were very interested to see if the whole plant extract inhalation in naive animals, no pain, produces any changes. We didn't see any differences again, like compared with the vehicle, the PhD thing. We didn't see any differences. So that was good. And then we compared just the naive animals, just normal animals, with animals in pain. Animals in pain, I mean that we did a procedure just to mimic this sciatic nerve kind of chronic pain that we experience, so we pretty much cut the nerve, and again, just the rats are like completely safe. We did. It sounds kind of weird saying like, "Oh, we cut the nerve," but serious is it's a very, very it's invasive, but it's not. It doesn't affect just the well-being of the rats. They recover in 30 minutes.
And they're anesthetized.
Yeah, they are anesthetized first. We take care of like infections or anything. We take care of them. We administer analgesics. After that. Not before the experiment, because that kind of mess up with the whole results. So yeah, all the experiments are performed like a week after the surgery, so they are completely fine. They move perfectly. So yeah, that's what we did, and we actually found that the chemical stimulation after the inhalation of this high CBD cannabis extract. The animals that we exposed to the WPE, the WPE reduces the perception of the pain induced by the chemical stimulation, but not the mechanical and not the thermal. So it was kind of selective, just and different based on the stimulus we used.
Well, and that's interesting too, because I think folks, again, often don't think about the fact that we experience pain through different mechanisms in the body. And so that's interesting that, the selectivity and how the whole plant extract is influencing the perception of pain. I know as I'm a medical cannabis patient with spinal cord injury, so I relate to this study quite a bit because I deal with a lot of neuropathic pain. So anecdotally, I have experienced something similar that I can get relief from certain types of pain with cannabis and not others. And like inflammatory pain and neuropathic pain are very different types of pain. et cetera. So I just wanted to point that out because that might be a new concept to some of our listeners, that there are different types of pain.
Right.
Especially if you're not someone that lives with chronic pain, you might not have thought about this before.
Yeah. So yeah, it was really, really important just to find, based on the different kind of stimulation, the effects of the cannabis plant extract is just selective, some specific stimulus. So yeah.
And where did the opioid administration fit into this? Did you allow the rodents to? Well, I think it's also worth mentioning the nose poke model. So these rodents were able to learn how to trigger exposure to these different treatments. So tell us a little bit about that.
Yeah. So when I explain this chronic exposure and I say 20 days, 2 times per day, that's just passive exposure, meaning that we put the rats in the chamber and then we turn it off, and every 30 seconds they had a puff of the extract.
And that's like a 5-second draw.
Yeah, it's
right?
5 seconds. Yeah. So they don't have to do anything. They just, stay there for 30 minutes each time, and they receive the puffs. But yeah, when I was talking to Adi and we were, kind of deciding what else we could do, it was an obvious question, like, what if we know that the percentage of THC was minimum, was 7% of something like that, but still it was there. And
right.
Again, previous research, we knew that CBD doesn't have like reinforcing effects. Like animals don't experience this desire just to administer itself compared to other drugs that they really like cocaine or heroin or something like that. But again, this was tested only, in males using these vapor chambers, or before using other kind of approaches like injections or orally. So we wanted just to test the potential rewarding effects of this compound in females through vapor administration. So the nose poke part is that the chambers have like 2 nose pokes, like in opposite walls. So the rats are very curious and they are very smart. So they go and they put the nose in there, and then they realize that there is a puff coming, and after like several associations, they are like, oh, if I do this, then the environment changes.
They learn how to vape for themselves.
Yeah. Yeah. So again, we wanted to compare the whole plant extract with high CBD versus the PGVG. So we did it again for I think it was 20 days. I don't remember that one actually.
I think it was
20 days. Yeah, it was 20
I think
days.
It's 20, yeah.
But in this case, because it was just like an active exposure, it was not like we automatically, put all the settings. Mm-hmm. It was more like they were operating the environment. So it was just one exposure per day, or one, we put them like for 30 minutes and see what they did during 20 days. So basically in this kind of designs, with rewarding drugs, what we see, it's a curve of learning, like at the very first day, they are like, oh, by coincidence, they either like press the lever or do the nose poke, and then they receive the drug. And over time, there is just like an exponential increase in the responses they do. So that's what we saw, but not with the cannabis plant extract. We saw that with the PGBG thing, and that was very, very unexpected for us. It was just like, why they are administering the PGBG.
It was very weird when I was reading the paper. I was like, wait a minute, what?
Yeah.
Like,
I mean, we didn't have a reason just to think that they were gonna administer the whole plant cannabis extract, besides the fact that it has a little amount of THC. And like the THC is just like the responsible of the rewarding effects. But it was like, maybe it's gonna be enough, the percentage just to self-administer. But no, they didn't like the PGBG. It's like they did leave it like nose bugs, and just like no. But surprisingly, they did it for PGBG, and that was very, very interesting for us as well, because again, majority of the studies have been using this compound as a vehicle, as an excipient, just to deliver other kind of drugs. And it's just like, but it has reward effects itself. So it's something very interesting that we outline in the discussion of the paper, just to be careful when interpreting like other results.
Exactly, yeah. That's what I was going to touch on, that this affects how you think about other results, because if there are other studies like this that are using PGVG or any sort of combination or separation of the two, this highlights that it's not having an effect. Like, it is definitely influencing the behavior of these rodents, and that has to be taken into account, because it's possible that there could be a conflation between thinking that that behavior was caused by a cannabinoid, when really maybe it was just caused by the vehicle to try to get those cannabinoids in the body. And if you don't understand that nuance, it can really confuse things quite a bit.
Right. Yeah, we were really, really surprised. Also, like kind of tie together these potential rewarding effects of PGVG with the lung damage. We think that it's really, really important, just to consider that, especially because we know that the PGVG and all the other excipients people use in the electronic cigarettes devices, they use very, very high temperatures, sometimes up to, like 450 Celsius. And at that point, just the chemical itself changes just through temperature. So, it potentially causes, like damage to the lungs.
Well, and I do want to point out too, I'm so glad you said that, because again, this study was so carefully thought out. But one thing that you pointed out in the manuscript is that one of the first things you wanted to identify was what's the right voltage and temperature for vaping, so that we don't create these other compounds that are then going to just cause even more conflations and conflicts and things in the data. So I want to point out to folks, you actually went through looking at different voltages, trying to see what things like benzene and other things are being produced, and to get that voltage low enough so that you're producing a vapor, but that really it's just got in it what was in the extract, and not a bunch of other things that may be causing damage.
Right. Yeah, we wanted to make sure to deliver CBD and to reduce like all the potential like harmful harm effects of just heating up just the extract and producing especially because we were very interested in test the safety profile of the cannabis compound extract.
Yeah.
So yeah.
And it's important for people listening, that the temperature matters quite a bit in terms of the safety of these products, and that if people want to, one thing that your study highlighted is that vaping causes changes in tissues. There's no way around it, even though it's presented as a safer alternative to smoking and all of these things. It's still not without risk. Even if it's a cannabis vape, there's still these changes that happen. However, if people are vaping, there are things they can do to enhance the safety of that. And one of the best things it seems like that they can do is keep that temperature low, so that they're at least only getting in what they intend to get in, and not all of these other byproducts.
chemical. Yeah. Yeah, it is nice that you mentioned, because yeah, we were also, interested showing like how this false perception of vaping is a safer alternative to smoking, because and I
Yeah.
see it right now with my clients. It's just like they are vaping and they are just like, oh yeah, this is nice, and I'm not gonna get like lung
Hmm.
cancer. And I'm like, wait a minute, you don't know, and we don't know yet. So yeah, yeah,
Yeah.
that's very important. So moving forward to the morphine and just the opioid cannabinoid interaction
Yeah.
that 80 was very interested also, to evaluate. Again, we had like different variables. So we didn't test this specific thing with animals in pain. It was just naive animals, just no pain. And we use this really, really nice approach, which is the condition place preference. And it's just a paradigm that in behavioral pharmacology we use a lot, just to, evaluate the potential addictive profile of a drug. Uh,
Yeah.
and it's just a very simple paradigm, but it's really, really beautiful, because we don't train the animals. There is no reward itself. It's just like the natural behavior of the animals. And
Yeah.
we
Yeah.
evaluated, like in this also very simple apparatus. It's just a 3-chamber apparatus, and there is like, 3 compartments. And the 3 compartments are different. The middle one is smaller compared to the side ones. Uh, and it's the middle one is called like the neutral chamber. And the sides are just
Gotcha.
like different in the color. The floor is different. It's just like different cues that rats
Yeah.
can associate. And randomly we pick one of the sites just to administer the drug. So we use morphine. Uh, and we counterbalance everything. It was just like for one animal, the morphine side is going to be, the side with the white walls and smooth floor. And for other animal, what was just to avoid, like kind of like bias related to the environment.
Gotcha. Yeah. Yeah.
So yeah, what we did was that approach. And the design of the experiment was just to develop this condition place preference to morphine, which is basically, again, we pick the rat, we administer morphine, and we put the rat in one of the sites, and we leave the rat just for like a few minutes there, and then they feel, the effects of the morphine, and just like, oh, I like this, and like after 7 days, no drug, and we put them back in the neutral, the middle chamber, and then the rat decides what side is the one they like. And of course, the one they like is the one they associate with the administration of morphine. So it's basically just the behavior of the rats are saying how rewarding is the drug. So
Yeah.
as much time they spend in the side prior to the drug administration is just higher is the reward value.
Right. Right.
So the design of this experiment was just to develop the CPP, and then right before testing, like without the drug, we put them in the chamber and see if the whole plant extract with high CBD kind of like reduce, like this the reward value of morphine. And what we
Yeah. If they want to spend less time
yeah,
in that morphine
right.
room.
So what we found is like actually, exposing the rats to the WPE reduce the reward value of morphine. It's just like compared to rats that they received only morphine and they
Yeah.
were not exposed to the whole plant cannabis extract. we saw a reduction in the place preference. It's just like they still like morphine, but the reward value of morphine was not as high as the rats that didn't have
Yeah.
the exposure.
Well, what was fascinating too, I remember reading in the paper, is that while the whole plant CBD extract seemed to reduce the reward value, you didn't see an influence on CBD's actual, like how the rodent experienced morphine itself. And make sure to correct me if I'm summarizing that wrong. But I remember seeing that it didn't seem like the extract was changing much about the pain relief that the rodent got from morphine. It's just really this reward association, the feeling of like, oh, I want to use that again or be near that again. And that's just a subtle difference, and it's interesting that it affected one without the other, because I think some people might intuitively assume that CBD would also affect the actual pain relief experienced by the rodents as well.
Yeah, well, again, this set of experiments, it was just pain naive animals. They were not in pain. We evaluate, like co-administration of the vapor exposure and morphine in another set of animals, but the CPP itself, it was just like animals with no pain. But that was also
just normal.
Just to test if there is an actual potential therapeutical effects of CBD, because we kind of digging in the literature, we know that there is less overdose accidents, or just less overdose incidents of opioids in the states where cannabis is legal. And so the main objective was to test if cannabis is useful to reduce the potential liability of morphine. So another important thing in this set of experiments was the reinstatement, because once we stop administering the morphine to these rats, they forget about it. After putting again and again without morphine administration, they are just like the preference to these chambers is just like they don't show any preference. But as soon as we administer a really minimum dose of morphine, then again the mechanisms, the learning and the physiological responses, they just go back, which is it is a model of relapse in humans.
Right.
Like when people relapse, they just need a minimum amount just to feel again all the
right, just sets everything in motion. All of that physiological memory. And that's, I think that alone is also worth highlighting. Like, that's a fascinating aspect of physiology, that you develop these associations, and you can be, because again, we see this, someone develops a problem with a substance, they go to rehab, let's say they go to a residential facility where they're there for 90 days or whatever. So they're removed from all of these triggers and cues. They get into a new, they reintegrate, they get into a new kind of a state of life and new habits, new patterns and everything. But there's that memory that in your body is all still there.
Right.
And the tiniest amount of reintroduction of that, whatever that was, and it doesn't necessarily have to be the chemical itself, it can be associations that were had with that chemical, but then all of that just comes rushing back. And that is very powerful to know. And it's not even just drug responses too, because even like trauma responses and things
they trigger
like that,
memory.
Yeah, exactly. It kind of sets a cascade of things that the body experienced in the past. And I think that's a powerful thing for people to stop and reflect on, of just how our bodies hang on to these prior experiences and traumas. And while, things can feel like they've gotten better or corrected, that all can just kind of be sitting there just below the surface.
Yeah, and this experiment is really really important in the sense that like for trying to translate to a human perspective, it's just like for someone that has been using opioids for a several amount of time, or like and then if you are exposed to CBD, then you're the reward of the opioid is not as big as a person, or
Yeah.
in this case they were rats, but the reward effect of the opioid is not as big as the rats that were exposed to the CBD. So
And is this something that can be viewed, like, as far as looking at like the nuclear accumbens and some of the parts of the brain involved in the reward circuitry? And this is me just kind of geeking out at this point, just thinking about how you study these things. But I'm just wondering, sort of like what studies have been done, to, like fMRI or otherwise, to even look at that. Because now that this study has been done, immediately I'm like, gosh, it would be fascinating to take people with substance abuse problems, that are trying to get help, going through treatment processes or whatever, and actually hook them up to fMRI and see if you can see a reduction in the activation of these reward circuits. Right. I would imagine in certain contexts, if it's measured the right way, you should be able to see that.
Yeah, I mean, after this, we started thinking like it would be great if we can do, like these other approaches, just even microdialysis, and measure like the release of dopamine after, getting the morphine injection. Is like, different approaches, and we just need the money and the time just to do the experiments. But the actual mechanism through which CBD reduce the reward effect of morphine, we don't know, and that's also like questions, like, oh, we need to test like different drugs and see what's the actual mechanism through
Right.
CBD is inducing these effects.
Yeah. And it and did you only look at morphine? I remember seeing a reference to fentanyl too, and I don't remember where I saw that or what that was in reference to.
We wanted to test also, like kind of in the same line, just to test if the exposure to high CBD vapor was able to reduce fentanyl reward. But for fentanyl, we used a complete different approach. It was not CPP. We tried doing the CPP, but again, we wanted just to do a translational research. And fentanyl, it's just like, and also this is just a methodological limitation, just like the half-life of fentanyl is really, really short. And that explains, why people is just injecting over and over again fentanyl, because it's just the window is really, really short. So the effect is really intense for a few minutes and then just goes away.
Metabolize quickly and excreted and start all over.
So for this, we use self-administration also in animals, but it should be through the vein. So it was an IV self-administration. And in this case, we use animals in pain, because previously Adi in her lab, when she was a postdoc, she published another study showing that actually in males, the exposure to CBD, not exposure, it was just injected, but cannabinoids reduce the potential or the reward of heroin. So we wanted to test this again using females, using vaporized CBD, and interestingly, we found another sex difference thing, in the sense that our our hypothesis was that animals in pain or females in pain were going to administer fentanyl more than animals that were
Right.
pain naive, and it didn't happen. It happened, like
Interesting.
surprisingly, females in pain administer less fentanyl than animals that are just naive animals. So that's another big difference, because again, AD, in her previous paper, they show that males that are in pain, they administer heroin more than animals that are not experiencing pain. So,
And is there any thought of why that might be?
um, well, we discussed a little bit, like this is clearly a sex difference. This is probably because of the model of pain we use. Again, like
Hmm.
we talk about like how pain is just like we can produce pain by different ways, different stimulations, or
Right.
also it could be like differences related to the drug itself. Just maybe heroin
Hmm.
doesn't have like the same profile as fentanyl. So
Yeah.
it could be, like purely sex differences. It could be because of the administration of the drug. It could be because of the pharmacokinetics of the heroin compared to fentanyl. So yeah, we actually
Yeah.
don't know. We can just, like hypothesize that.
Speculate. Yeah.
Yeah.
Well, that's fascinating. That just opens up more. Yeah, that's the great thing about good research is it always gives you more questions. You're always left with more questions to ask and
Right.
more things that you want to see answered. Because yeah, that is fascinating. Because that was my intuition as well. Is that especially given that the supporting data that females tend to experience chronic pain more. Um, it's just sort of a series of things where you think, well, maybe the pain's greater or something, or maybe there would be
Well, yeah, and there is also, like an hypothesis there that females experience pain different. Like the perception of pain in
yeah,
females
yeah,
is just different. So maybe like the motivation just to relieve that pain is also different. So that could be an option. Or like it's likely to think
yeah,
that
yeah.
females are handling better just the pain compared to males, and it's just, they just don't need to administer the drug.
Well, yeah, and I mean it makes me wonder just from a very like practical perspective of conversations I've had with my wife, where we've speculated whether women develop greater pain tolerance, even though they experience more because they experience it so frequently. Like my wife has dysmenorrhea, so very, very painful periods and things like that. And we've sort of joked of like, well, you've experienced so much pain
Yeah.
in your life already, so maybe these other times that you experience pain, maybe you're just kind of like your body's adjusted in ways that mine hasn't, because I don't experience that. It's really fascinating, and it does just highlight all of these nuances of why representation in biomedical research is so important. Because something I wonder about too with these sex differences is we see, already significant sex differences in rodents and things like that. When you start getting into human research, I'm wondering, like, well, what would the differences be, let's say, in, someone who's undergoing like a hormone therapy, whether it's like a gender transition or a cancer therapy that's dealing with hormone deprivation, or any of these scenarios where someone is experiencing I guess more or less kind of a traditional atypical kind of hormone profiles. How does that come up, and what sort of things should clinicians be thinking about depending on their individual patient? There's a lot of implications to this line of thinking and taking these considerations into this type of research that goes, I think, way beyond what a lot of people, kind of immediately intuit.
Yeah, there is just a lot of variables to consider, in management of chronic pain, just like age matters, sex matters, like, um,
Yeah.
yeah, it's just also like coming back to the paper, it's kind of interesting also to show that um, the regardless of having pain or no pain, something just to confirm that, something that it was nice to confirm this previous result in the
Mm-hmm.
CBP paradigm. It was also like animals, regardless of like the pain condition or not, when we expose them to the WPE, to the whole plant cannabis extract, they administer less fentanyl in general. So that was also really really important, and it's just like this whole idea that using cannabis will be helpful just to stop this developing of opioid dependence or opioid addiction.
Yeah.
Um,
Yeah, I mean, there's so much. Yeah, there's so much potential in how to, one, just take the basic understandings from this paper and start to integrate them into how we think about drug treatment and that sort of thing. But then follow up studies that I imagine are probably already in the works in response to this to try to investigate some of these angles that we've talked about, these questions that kind of emerge from these findings. This is huge. And I already realized, see, I told you at the beginning an hour was going to go by extremely fast.
yeah.
And it already has. So I want to make sure to be respectful of your time. So I guess one of the last questions that I'll ask you is, what do you hope that people take away from this study? And in hearing us talk about it, and I'm going to push people to go look the study up and read it. What do you really hope personally that they walk away learning from this study, and what do you hope to see in the future from potentially other researchers that are investigating these interactions between cannabis and opioid use?
Well, definitely, again, from my, I don't like to say that I'm a feminist, but like definitely just focusing more in females research.
Yeah.
That's something that people should start doing. Sex differences is a thing that for years, for decades, in research was completely ignored. And now we are transitioned to this new age where actually there is more communication between clinical practice and researchers. I feel what I've seen not only here but in Mexico too. It's the how in the past just traditional researchers doing preclinical studies, it was just this person living in the lab all the time and not looking
Yeah.
outside,
Yeah.
not seeing what's happening. Even like people studying like drugs of abuse, it's just like, well, it's just all theoretical. And I'm not saying I'm not encouraging people just to use drugs, but like just like the description in the books, it's just it doesn't line up with the actual experience that people is reporting out there, like in the streets.
Yeah.
uh, so yeah, I say like we are moving to an era where research is more like in this line to be translational, to be like to include, to
Yeah.
be like more, yeah, of course, more inclusive, but also considering that we are all different. Obviously, like females versus males, there is going to be difference, but there is also like individual differences. So the perception of
Right.
the drug, it's not the same among people. So again, we are not saying that, like cannabis with this study, we are not saying that cannabis is gonna cure everything, or CBD is gonna cure everything, but it's a very useful tool just to
Yeah.
reduce,
Yeah.
the first to manage pain, and that's it is well known that just reduces pain, and also just to reduce the liability of opioid consumption. It's just like, especially now that no one is saying that opioids are not useful. We know that
Right.
opioids are great to treat pain, especially acute pain. But
Yeah.
we know also like all the side effects that they have, like development of addiction, overdose, just like tolerance, they stop working. So
Yeah.
what we are saying is just like CBD is, it's just a potential tool just to relieve pain, just to manage pain. um, and yeah, I will say that that was the main objective of the paper. Just start looking in females, start looking in sex differences, and
Yeah.
start like opening just the opportunities, the research, just to continue doing this job, and in cannabis research. And
Absolutely. I mean, it's a great message, and it really highlights kind of the intersection of philosophy and science. Really, it's one thing, like you said, to get in a lab and do all these things you can do and create all this data, but then at some point you've got to ask, what are we doing and why? And that has to also guide the decisions that we make in the lab, so that the data that we're producing actually connects and isn't just data for the sake of data. Um, and I really like that, because I think that's been needed for a while. I think for decades and decades, it's just kind of been a push to get graduate students to publish papers and make data, and that's kind of how academia has gone. And it's well past time to really focus on practical research and what is actually going to help people and drive decisions. And a study like this, I think about people in like my wife's network of professionals, mental health counselors and stuff that are involved in drug treatment. This tells them, okay, if someone is trying to transition off of chronic use of opioids for whatever they've been using them for, or if they've been using them recreationally or whatever, okay, so it's okay to maybe let them know that, using CBD or a whole plant CBD-rich extract might help in this transition period, so that you don't, feel as intense cravings for this compound or something. It gives, it's a very powerful tool for a lot of drug treatment people to really think about, because these transitionary periods are the most critical ones usually when you're trying to get someone, when they've been taking this for every day for 10, 20 years, and you're saying, okay, we have to make a change, and that's a very scary change to make. So having tools like this to know that there may be some ways to make this process easier, more comfortable, and more successful overall is huge, incredibly impactful to a lot of people around the world. So with that, I know I've kept you about 10 minutes over, but I really appreciate you spending the time today and really unpacking the study. I hope that everyone listening will go read it and recognize what I see in it, of why I'm so excited about it. And yeah, I did a live stream on YouTube just the other day looking at a different research study, kind of going through my thoughts, how I think about research and the questions I'm asking as I'm going through it. And I used one that was very, what I would say, I hate saying low quality, but I have a specific meaning when I say that, but it's kind of a low quality study in terms of its predictive power. And this is kind of on the opposite spectrum. And so I really like being able to point out to folks how to think about research, how to think about the implications, and how to properly guide our assumptions and conclusions that we make off of that. So this has been really, really valuable in a lot of ways, I think, in helping people not only understand this specific study and the implications of that, but also all of the work that just goes into trying to ask what sometimes seem like very simple questions, and all of the different considerations and nuances that you really have to pay close attention to ensure that the data you get at the other end is really useful and valuable. So with that, I appreciate all the work that you've done, both in this paper and the work that you're continuing to do going into the future. So thanks for everything, and thanks for being willing to spend time with our audience today. I really appreciate it.
Sure. Thanks for the invitation. You know, like, again, it's just it's very, very important for me, especially for my background, especially for the work I'm doing right now. I know science is just like a very, very important aspect, but we need to start doing more clinical approach, you know, like talking more like preclinical research with clinicians. And yeah, sometimes again, I feel now that I'm part of the clinical intervention people, it's just like, there is a huge gap, you know, like when talking about like neurotransmitters, when talking about like mechanisms, clinicians are just like, oh no, those concepts are just like we don't read that. And the, on the other side is the same. It's just like for people doing research, they don't know, like, you know, how it's just to work with people, with patients, with like what are their experiences, just what they can do, you know, like you mentioned, just like it's a very useful tool just to recommend people. It's just like, okay, you don't stop just taking your opioid, right? Because you are going to experience a really bad withdrawal. So yeah, again, we are not encouraging just to use cannabis, but it's a powerful tool. And
yeah, absolutely. And the data's, you know, continuing to support that and to clarify the appropriate uses of that tool, which is something I always try to go back to. Is all of these things, they're tools, and really all of this research is trying to figure out how do we best use this tool to do the most good and the least harm. Right. And that's really what it comes down to. So yeah, thanks so much for your work, and everyone listening, again, let me repeat the title of the paper in case you listen all this way and you're ready to go look it up. It's High-CBD Cannabis Vapor Attenuates Opioid Reward and Partially Modulates Nociception in Female Rats. Go look it up. It's a long one, but it is worth reading. A lot of good stuff in there. And thank you so much. And I hope we connect again. Yes, it is. It's open access. And thank you for making it that way, because I also know that it is not free to make things open access either. So I appreciate that quite a lot, and I hope others do too. There's a lot of things in academia that people really don't. Yeah. People assume that reviewers get paid. People assume open source articles are free. Not at all. None of that's the case. Yeah. But anyway, so with that, everybody, thanks so much for listening through the whole episode. I hope you learned a lot, and I hope this has made you think a bit about some of the research that you see. And with that, everybody, I'll catch you in the next episode. Stay curious and take it easy. If you like this video, be sure to subscribe, hit the bell icon so you get notified of more videos, and go ahead and check out another video while you're at it.